reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and commitment therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45: Nanotechnology in Acne Treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and Climate Adaptation Strategies for Acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne Success Stories, Effective Patterns, and Realistic Timelines for Clear Skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involuntary. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, erbium YAG, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments tried and their results, family history of acne, recent lifestyle changes, menstrual history, if applicable, and medications or supplements you take. Bring photos of your acne at different stages if possible. Discuss your specific concerns, whether you're most worried about current acne, scarring, or overall timeline to clear skin. Your dermatologist can prescribe prescription-strength treatments unavailable over the counter. Prescription retinoids, tretinoin, adapalene, tazarotene, are more powerful than over-the-counter retinol. Prescription antibiotics, oral doxycycline, minocycline, or topical clindamycin, treat bacterial acne. Spironolactone manages hormonal acne in women. Isotretinoin, Accutane, is a last-resort powerful medication for severe acne resistant to other treatments. Your dermatologist can identify acne triggers specific to you and recommend appropriate prevention strategies. They can also recommend or perform professional treatments like chemical peels, laser therapy, or extraction that aren't accessible outside dermatology. Finding a good dermatologist matters. Ask for referrals from your primary care doctor, friends, or family. Check online reviews and credentials. During your first visit, assess whether the dermatologist listens to your concerns, explains treatments thoroughly, and seems genuinely interested in helping you. A good dermatologist-patient relationship improves treatment outcomes. Guide 17, Treating Rosacea, Seborrheic Dermatitis, and Other Acne-like Conditions. Several skin conditions mimic acne but require different treatments. Misdiagnosis leads to inappropriate treatment and worsening of the underlying condition. Understanding these conditions helps ensure proper diagnosis and effective treatment. Rosacea is a chronic inflammatory condition characterized by facial flushing, persistent redness, small blood vessels, and sometimes pustules. Unlike acne, rosacea typically doesn't involve comedones and occurs more commonly in adults over 30. Rosacea is triggered by heat, spicy foods, alcohol, stress, and certain skincare products. Treatment focuses on trigger avoidance and skin barrier repair rather than bacterial killing. Becomes thin, allows excessive water loss, and becomes reactive to previously tolerated products and environmental factors. Signs of barrier compromise include tightness and discomfort, increased dryness and flaking despite using moisturizer, redness or inflammation without active acne, stinging or burning when applying products previously tolerated, increased sensitivity to temperature extremes, and heightened reactivity to skincare products, developing reactions to products that previously seemed fine. Several factors compromise the skin barrier during acne treatment. Multiple chemical exfoliants, salicylic acid, glycolic acid, used simultaneously strip away protective lipids excessively. Retinoids, while beneficial, can compromise the barrier during the initial adaptation phase. Benzoyl peroxide can be somewhat drying. Hot water and harsh cleansing compromise the barrier. Excessive sun exposure damages barrier function. The cumulative effect of multiple treatments or very aggressive single treatments overwhelms the barrier's ability to maintain function. Barrier repair requires specific approaches different from standard acne skin care. The goal shifts from treating acne to restoring skin health. This recovery phase typically lasts 2 to 4 weeks but can take longer with severe barrier compromise. The first step in barrier repair is stopping all unnecessary irritants. This means discontinuing strong actives temporarily. Stop salicylic acid, benzoyl peroxide, and retinoids. Stop chemical exfoliants. Stop high-concentration vitamin C or other potentially irritating ingredients. Use only gentle, basic skin care during the recovery phase. Gentle cleansing becomes paramount. Use only lukewarm or cool water with a very gentle, minimal cleanser or even just water cleansing. Avoid all manipulation or massage of the skin. Pat dry gently, don't rub. Minimize cleansing time, wash quickly and gently rather than scrubbing or massaging. Lipid-rich moisturizing is essential. Your barrier needs ceramides, cholesterol, and fatty acids. Moisturizers containing these lipids support barrier repair. Apply moisturizer to slightly damp skin immediately after cleansing to lock in hydration. Use generous amounts, don't skimp on moisturizer during barrier repair. Many people find that using moisturizer 3 to 4 times daily during barrier repair accelerates recovery compared to twice daily application. Humectant-rich products maintain skin hydration. Ingredients like hyaluronic acid, glycerin, and squalane draw water into the skin, supporting hydration during barrier repair. Many hydrating serums or essences contain these ingredients. Apply these before your moisturizer to layer hydration. Some people benefit from occlusive products during barrier repair. An occlusive final layer locks moisture into skin. Facial oils, jojoba, squalane, or balms create an occlusive layer over your moisturizer. This is particularly helpful at night when you're not exposed to environmental stressors. Centella asiatica, SICA, is a botanical ingredient that supports skin barrier repair through multiple mechanisms. It strengthens the barrier, reduces inflammation, and promotes skin resilience. Many products now contain SICA for its barrier-supportive properties. Using a SICA-containing product during barrier repair can accelerate recovery. Avoid all environmental stressors during barrier repair. Don't expose skin to extreme temperatures, hot showers, very cold weather. Use a humidifier to maintain ambient humidity, as dry air worsens barrier compromise. Avoid air conditioning when possible, it's drying, or use a humidifier to counteract its effects. Protect skin from sun exposure, wear sun protection even though you're not using UV sensitizing treatments. Avoid actives and potential irritants completely during barrier repair. This means no vitamin C, no niacinamide in high concentrations, no peptides, no strong antioxidants. Even gentle ingredients might irritate severely compromised skin. Stick to cleanse, hydrate, moisturize, protect as your only routine. Timeline for barrier recovery typically takes 2 to 4 weeks. By week 1, you should notice reduced tightness and reactivity. By week 2, increased tolerance and reduced dryness. By week 3 to 4, most barrier compromise resolves. However, severely compromised barriers might take 6 to 8 weeks for complete recovery. During barrier recovery, you can still protect your skin from future acne. Using SPF 30+ sunscreen is essential and doesn't compromise recovery. In fact, it supports it by protecting your recovering skin. Sunscreen should be your only active product during this phase. Once your barrier has recovered, you're comfortable, no longer experiencing tightness or reactivity, and your skin feels resilient again, you can gradually reintroduce active treatments. However, do so carefully and at lower concentrations and frequencies than you used before. For example, if you were using 2% salicylic acid daily before barrier compromise, restart with 0.5% salicylic acid 2 to 3 times weekly. Build up slowly. Reintroduce treatments one at a time, waiting at least 1 to 2 weeks between introducing new actives. For example, reintroduce salicylic acid first, wait 2 weeks to ensure tolerance, then introduce benzoyl peroxide if desired. This sequential approach prevents recompromising your barrier. The barrier repair phase teaches valuable lessons about acne treatment. It emphasizes that more aggressive treatment isn't always better. Often, moderate treatment applied consistently yields better long-term results than aggressive treatment causing barrier compromise requiring recovery phases. Maintaining a healthy barrier improves overall skin health and can actually improve acne outcomes by supporting skin function. Some people find that once their barrier recovers, they can maintain clear skin with gentler treatment than they used before barrier compromise. For example, someone might have needed 2% salicylic acid daily and benzoyl peroxide to control acne, but after barrier recovery and switching to gentler 0.5 to 1% salicylic acid with retinoid maintenance, their acne stays controlled. This suggests that excessive barrier compromise actually worsened acne by disrupting skin function. Prevention is better than recovery. From the start of acne treatment, use appropriate concentrations and frequencies, incorporate moisturizing and barrier support, and listen to your skin's signals. If your skin is becoming very dry, tight, or reactive, reduce treatment intensity rather than continuing and causing more barrier damage. Long-term consistency matters more than short-term intensity. Guide 27. Cosmeceuticals and advanced skincare ingredients beyond standard acne treatments. Beyond the well-established acne treatments like benzoyl peroxide and salicylic acid, numerous cosmeceutical ingredients support acne treatment and skin health. Understanding these advanced ingredients allows you to optimize your acne regimen and support overall skin function. Peptides are short chains of amino acids that support skin structure and function. Some peptides have been studied for acne-supportive effects through anti-inflammatory mechanisms and barrier support. Matrixyl and similar peptides appear in many skincare products. While peptides aren't primary acne treatments, they support overall skin health and resilience. They're generally gentle and well tolerated. Include peptides in your routine for general skin support without expecting them to treat acne directly. Hyaluronic acid is a humectant that holds up to 1,000 times its weight in water, providing significant hydration. While it doesn't treat acne, maintaining proper hydration through hyaluronic acid improves skin function and barrier health. Using hyaluronic acid serums or moisturizers provides hydration support for acne-prone skin. Squalane is a lightweight oil that mimics skin's natural sebum without being comedogenic in most individuals. It provides hydration and lipid support for barrier function. Squalane is particularly useful for acne-prone skin that needs lipid support without the pore-clogging risk of heavier oils. A few drops of squalane can be added to moisturizer or serum for enhanced hydration. Niacinamide, vitamin B3, has multiple beneficial effects for acne-prone skin. It has mild antibacterial and oral antibiotics like doxycycline, risks to fetus and teeth, spironolactone, potential effects on male fetus development. Benzoyl peroxide is traditionally avoided, though new evidence suggests safety. Potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible, though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin, some. Routine predictability helps sensory-sensitive individuals. Consistent routines in consistent order reduce sensory overwhelm compared to variable routines. Minimal product routines, fewer products means fewer sensory inputs, might be better tolerated than complex multi-step routines. A simple cleanse, treat, moisturize routine might work better than elaborate routines. Fragrance sensitivity affects many products. Fragrance-free or lightly scented products work better for fragrance-sensitive individuals. Sensory-friendly product recommendations: lightweight serums, fragrance-free formulations, smooth-absorbing products, minimal texture variations, consistent temperatures, and routines. Professional guidance from dermatologists familiar with sensory sensitivities helps develop manageable treatment plans. Guide 90, Acne and Chronic Illness, Managing Acne while Managing Other Conditions. People managing chronic illnesses, diabetes, autoimmune diseases, chronic fatigue, etc., face additional challenges managing acne alongside other health concerns. Chronic illness causes stress, sleep disruption, and immune dysfunction, all acne worsening factors. Flares of underlying chronic conditions often coincide with acne worsening. Medications for chronic illnesses sometimes interact with acne treatments, requiring careful coordination. Energy limitations from chronic illness might make complex skincare routines unsustainable. Simplified routines are sometimes necessary. During chronic illness flares, simplifying skincare to basic cleanse protect routines is appropriate. During periods of better health, more comprehensive acne treatment is possible. Mental health in chronic illness overlaps with acne's psychological burden. Both require professional support. Healthcare provider coordination between specialists treating chronic illness and dermatology ensures appropriate care. Prioritizing which health concerns to focus on during periods of limited energy helps. Sometimes managing underlying chronic illness takes priority over aggressive acne treatment. Guide 91, Acne Treatment and Vaccination, Timing and Considerations. Concerns sometimes arise about acne medication interactions with vaccines or vaccine effects on acne. Most acne treatments don't interact meaningfully with vaccines. Topical treatments have minimal systemic absorption and don't affect vaccines. Oral antibiotics for acne don't affect vaccine efficacy. Vaccines should be given as scheduled regardless of antibiotic use. Isotretinoin doesn't interact with vaccines, though the immune system suppression during severe acne might theoretically reduce vaccine efficacy. Live vaccines are contraindicated during isotretinoin use due to theoretical immunosuppression risks, though actual risks are minimal. Some vaccines might cause temporary acne flares through immune system activation. This is temporary and doesn't indicate vaccine problems. Vaccines don't cause persistent acne. Any acne appearing after vaccination is likely coincidental timing rather than vaccine-related. COVID-19 vaccines have not been shown to affect acne or interact with acne treatments. Timing vaccines around acne treatment is generally unnecessary. Vaccinations and acne treatment can proceed on standard schedules without coordination. Guide 92. Acne prevention in high-risk children and adolescents. Children with strong family history of severe acne are at high risk for developing severe acne. Early prevention strategies might prevent progression to severe acne requiring aggressive treatment. Starting gentle skin care routines early, non-comedogenic cleansing, sun protection, gentle moisturizing, establishes good habits before acne develops. Education about acne prevention helps young people understand triggers and prevention even before acne appears. Stress management skills learned early help reduce stress-related acne worsening later. Healthy diet and sleep habits established in childhood support skin health throughout life. Early intervention at first signs of acne prevents progression. Some dermatologists recommend seeing high-risk children early for preventive guidance. Avoiding triggers identified through family acne patterns, particular foods, products, environmental factors, might prevent acne development. Psychological preparation for potential acne, normalizing that acne is common, reducing stigma, helps adolescents manage it psychologically if acne develops. Guide 93. Acne in Performing Arts and Image-Dependent Professions. Performers and those in image-dependent professions, models, actors, social media influencers, experience unique acne-related pressures warranting specialized management. Career-threatening pressure intensifies acne's psychological impact. A small breakout affecting someone's livelihood differs from same breakout's impact on others. Professional makeup demands acne coverage requiring heavy makeup potentially triggering acne cosmetica. Using non-comedogenic makeup and proper removal helps minimize this. Professional headshots and promotional photos emphasize clear skin. Acne interferes with professional image management. Scheduling professional appearances around acne cycles when possible helps. If acne is cyclical, scheduling performances during clear phases. Professional dermatology involvement is often valuable for ensuring consistently clear skin during critical professional periods. Some performers use preventive acne treatment intensification before important performances, temporarily increasing treatment frequency. Mental health support helps manage the intensified appearance pressure these professions create. Guide 94. Acne and Sleep Disorders, Managing Acne While Managing Sleep Issues. Sleep disorders, insomnia, sleep apnea, restless leg syndrome, create multiple acne worsening factors making acne management more challenging. Sleep deprivation from any sleep disorder worsens acne through stress hormone, immune, and inflammatory mechanisms. Sleep medications sometimes worsen acne. Discussing with sleep specialists whether acne worsening might relate to sleep medications is appropriate. Treating underlying sleep disorders often improves acne significantly through improved sleep quality and stress reduction. Managing both sleep and acne requires comprehensive approach addressing both conditions. CPAP machines and other sleep disorder treatments might trigger acne through skin irritation. Using protective barriers and keeping equipment clean helps. Guide 95, Acne and Fertility, Female and Male Considerations. Acne treatments have fertility implications requiring consideration for those planning pregnancy or concerned about fertility. Isotretinoin is highly teratogenic and absolutely contraindicated in pregnancy. Women of childbearing age must use reliable contraception while on isotretinoin. Spironolactone might affect male fetus development. Stopping spironolactone while planning pregnancy or if pregnancy occurs is generally recommended. Birth control pills used for hormonal acne obviously affect fertility planning. Stopping pills when planning pregnancy allows pregnancy attempt. Other acne treatments don't significantly affect fertility and can be continued during fertility attempts. Male fertility is theoretical. Most retinization symptoms peak at weeks 2 to 4 and resolve by weeks 6 to 8. However, expecting this phase mentally prepares you to persist through it rather than discontinuing retinoids prematurely. Managing retinization involves strategic moisturizing. The sandwich method, applying retinoid, waiting 20 minutes, applying moisturizer, waiting a few minutes, then applying another thin moisturizer layer, significantly reduces retinization severity while maintaining efficacy. As your skin adapts over 8 to 12 weeks, you can gradually stop using the sandwich method, eventually applying retinoid directly to dry skin. Buffering retinoid strength temporarily by mixing it with moisturizer reduces irritation without substantially compromising effectiveness. Some experienced retinoid users eventually apply retinoids directly to skin for maximum strength, while others continue using the sandwich method indefinitely because it works well for them. There's no wrong approach. Use whatever maintains your skin health while providing desired results. Niacinamide effectively reduces retinoid irritation. Using niacinamide serum in the morning and retinoid at night doesn't provide the irritation-reducing effect. However, some evidence suggests applying niacinamide before retinoid, allowing niacinamide to dry, then applying retinoid on top, might reduce irritation slightly. This is controversial, with some experts suggesting niacinamide interferes with retinoid efficacy, while others dispute this. For most people, using niacinamide and retinoid at different times is the safest approach. Ceramide-rich moisturizers particularly well support retinoid use by maintaining barrier health during treatment. Using moisturizers specifically formulated with ceramides, cholesterol, and fatty acids alongside retinoids helps prevent excessive dryness and irritation. Combining retinoids with other actives requires careful sequencing. Retinoids should not be combined with AHAs, BHAs, or vitamin C initially. After 12+ weeks of stable retinoid use, you might carefully introduce another active on different nights. Many experienced users successfully use retinoid nightly and salicylic acid or benzoyl peroxide on alternate mornings, but this requires well-adapted skin. Retinoid stability matters for effectiveness. Retinol degrades with light and air exposure. Products in opaque, airtight packaging remain stable longer than those in clear or non-airtight packaging. Storing retinoid products in cool, dark places preserves stability. Retinoids become less effective as they degrade, so proper storage extends product effectiveness and lifespan. Retinoid pulse dosing. Using retinoids intensively for periods, then taking breaks, is a strategy some dermatologists recommend. The theory is that continuous daily use might cause adaptation, reduced effectiveness, while pulsing maintains efficacy. However, most retinoid experts recommend continuous daily use for consistent results. Occasional breaks for barrier repair are reasonable, but pulsing isn't necessary for maintaining retinoid effectiveness long-term. Combination retinoid protocols use multiple retinoids simultaneously for enhanced benefit. For example, using low-concentration tretinoin at night combined with retinol in the morning. However, this advanced approach requires very well-adapted skin and should only be attempted under professional guidance. It increases irritation risk and isn't necessary for most people. Pregnancy and retinoid use requires special consideration. Retinoids are teratogenic and should not be used during pregnancy. Women of childbearing potential using isotretinoin must use reliable contraception. Tretinoin used during pregnancy is controversial. Some studies suggest it's safe at prescribed topical doses where systemic absorption is minimal, while others recommend avoiding it. Discuss retinoid use with your obstetrician if planning pregnancy or pregnant. Adapting retinoid use seasonally may be beneficial. In winter, when skin is naturally drier, you might reduce retinoid frequency or concentration, or increase moisturizing support. In summer, if your skin tolerates it, you might increase retinoid frequency for more aggressive treatment. Signs of excessive retinoid use include severe dryness, persistent redness beyond the initial retinization phase, barrier compromise, or contact dermatitis. If you experience these, reduce frequency or concentration. There's no badge of honor for using the highest concentration or frequency if your skin is suffering. Optimal retinoid use maintains healthy skin while providing acne and anti-aging benefits. Guide 34. Sleep quality and acne, mechanisms, optimization strategies, and sleep-specific skincare. Sleep profoundly affects acne through multiple physiological mechanisms. Understanding sleep acne connections and implementing sleep optimization and sleep-specific skincare significantly improves acne. During sleep, your body undergoes restorative processes crucial for skin health. Growth hormone peaks during deep sleep, supporting skin repair and collagen production. Cortisol, the stress hormone, declines during sleep, reducing inflammation. Immune function is enhanced during sleep, supporting the body's ability to fight infection-causing bacteria. Cellular turnover occurs during sleep, with dead skin cells being replaced by new ones. All these processes directly support clear, healthy skin. Poor sleep disrupts these beneficial processes. Insufficient sleep, less than 7 hours nightly, increases cortisol, promotes inflammation, impairs immune function, and disrupts cellular turnover. The result is worsened acne within days of poor sleep. Many people notice acne worsening after only 1 or 2 nights of insufficient sleep, demonstrating sleep's direct acne effects. Sleep timing matters as much as sleep duration. Your body has a circadian rhythm, an internal clock regulating hormone release and physiological processes. Disrupted circadian rhythm, from shift work, irregular sleep schedules, or jet lag, worsens acne even if total sleep duration is adequate. Maintaining consistent sleep schedules, going to bed and waking up at the same times daily, optimizes circadian rhythm function and supports skin health. Sleep quality matters beyond duration. Fragmented sleep with frequent awakenings, even if total sleep time is adequate, compromises skin health. Poor sleep quality is associated with worse acne. Improving sleep quality requires addressing sleep disruptions through sleep hygiene optimization. Sleep position might influence acne through mechanical and bacterial mechanisms. Sleeping on your back avoids facial contact with pillows and your hands, reducing friction acne and bacterial transfer to your face. Sleeping on your side or stomach involves prolonged face pillow contact, increasing friction and bacterial exposure. However, changing sleep position is difficult if you're not accustomed to it. If you naturally sleep on your side or stomach, prioritize other acne management strategies rather than forcing an uncomfortable sleep position change. Pillowcase cleanliness significantly impacts acne. Dirty pillowcases accumulate bacteria, oil, and dead skin cells, all of which transfer to your face during sleep. Some dermatologists recommend changing pillowcases every 2 to 3 days for acne-prone individuals. Alternatively, sleeping on a clean towel over your pillowcase and changing the towel daily is effective and economical. Some people with severe acne benefit from silk or satin pillowcases, which create less friction and accumulate less bacteria than cotton. Bedroom temperature affects sleep quality. Warmer rooms increase perspiration, creating a moist environment promoting bacterial growth and acne. A cooler bedroom, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, supports better sleep and reduces nighttime sweating. If your bedroom is too warm, using a fan or air conditioning improves both sleep quality and acne through multiple mechanisms. Humidity in the bedroom affects skin and sleep. Excessively dry air, from heating systems or dry climate, irritates skin and disrupts sleep. Excessively humid air promotes bacterial growth and acne. Moderate humidity, 30 to 50%, is optimal. Using a humidifier in dry climates or a dehumidifier in humid climates optimizes sleep environment and supports skin health. Light exposure, particularly blue light from screens, suppresses melatonin production, disrupting sleep timing and quality. Using devices before bed worsens sleep through this mechanism. Stopping screen use 30 to 60 minutes before bed improves sleep quality. Using blue light filters on devices if evening screen use is unavoidable provides some protection. Comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for transfeminine individuals, typically improves acne over time as androgens are suppressed. Many transfeminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne-beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in transfeminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established. Gentle skin care is foundational for rosacea. Avoid physical scrubs, harsh cleansers, and irritating products. Use fragrance-free, gentle cleansers and soothing moisturizers. Many rosacea patients benefit from products containing Centella asiatica, cica, oat extract, or hyaluronic acid. Avoid very hot water, using lukewarm water instead. Don't use topical corticosteroids chronically, as they worsen rosacea over time. Azelaic acid is highly effective for rosacea, approved by the FDA for this condition. At 15 to 20% concentration, applied twice daily, azelaic acid reduces redness, pustules, and flushing. This is one of the few treatments that's both gentle enough for rosacea and sufficiently potent to provide real benefit. Oral antibiotics, particularly doxycycline at subantimicrobial doses, reduce rosacea inflammation. Low-dose doxycycline, 20 to 50 mg daily, has anti-inflammatory effects beyond its antibacterial properties. Metronidazole is another oral option. Topical metronidazole gel also reduces rosacea symptoms. Topical sulfacetamide sulfur products help control rosacea, particularly pustular rosacea. These are gentle enough for sensitive rosacea-prone skin while providing therapeutic benefit. Laser treatments, particularly those targeting blood vessels, vascular lasers, effectively reduce rosacea's persistent redness and visible blood vessels. Multiple treatments are typically necessary. Intense pulsed light, IPL, therapy is also effective for rosacea. Seborrheic dermatitis causes inflammation, redness, and flaking, often on the face, scalp, and other oily areas. Unlike acne, seborrheic dermatitis involves fungal overgrowth, Malassezia yeast, and isn't bacterial. Antifungal treatments are therefore necessary. Topical antifungals like ketoconazole, zinc pyrithione, or selenium sulfide reduce seborrheic dermatitis. These are available in shampoos, creams, and lotions. Antifungal products should be applied to affected areas 1 to 2 times daily until improvement, then used for maintenance. Mild topical corticosteroids reduce inflammation and itching in seborrheic dermatitis. However, chronic steroid use can worsen the condition, so use them short-term or intermittently. Perioral dermatitis presents as a rash around the mouth, often triggered by heavy moisturizers or topical corticosteroids. Treatment involves stopping the trigger, typically discontinuing steroids or heavy moisturizers, using gentle, minimal skin care, and sometimes using topical antibiotics. Low-dose oral doxycycline sometimes helps. Fungal acne, Pityrosporum folliculitis, appears similar to acne but results from yeast overgrowth rather than bacterial acne. It typically appears as small, uniform pustules, often on the back and chest. Standard acne treatments don't help, antifungal treatments are necessary. Topical antifungals, ketoconazole, zinc pyrithione, or oral antifungals, fluconazole, itraconazole, are effective. Some dermatologists recommend oral antifungals even for facial fungal acne due to systemic involvement. Folliculitis is inflammation of hair follicles, appearing similar to acne but resulting from bacteria, irritation, or friction rather than typical acne pathophysiology. Treatment depends on the cause. Bacterial folliculitis responds to antibiotics or benzoyl peroxide, but other folliculitis types may require different approaches. Professional diagnosis ensures appropriate treatment. Post-inflammatory erythema is persistent redness remaining after acne heals, different from permanent scarring. This redness gradually fades over months with sun protection and time. Vascular lasers or intense pulsed light can accelerate resolution of stubborn erythema. Professional diagnosis is essential when you're uncertain whether you have acne or another condition. Many conditions are treatable once properly identified, but misdiagnosis leads to frustration and worsening symptoms. If your acne doesn't respond to standard treatments or presents atypically, ask your dermatologist to rule out other conditions. Guide 18: Managing Acne Treatment Side Effects and Building Tolerance. Most effective acne treatments cause side effects during initial use. Understanding how to manage these side effects allows you to continue treatments despite discomfort, achieving clear skin. Side effects typically diminish as your skin adapts, but managing them during the adaptation phase is important. Dryness is the most common side effect of acne treatments. Salicylic acid, benzoyl peroxide, retinoids, and sulfur all commonly cause dryness. Manage dryness through aggressive moisturizing. Increase moisturizer frequency to twice daily, morning and night, or even 3 times daily if necessary. Choose hydrating, non-comedogenic moisturizers with hyaluronic acid, glycerin, or ceramides. Apply moisturizer to damp skin to lock in hydration. Use the sandwich method if dryness is severe. Apply your treatment, wait 20 minutes, then apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. Some people find using a facial oil, just a few drops, over moisturizer helpful for managing dryness, though oils can clog pores in susceptible individuals. If oil worsens your acne, skip this step. Peeling and flaking occur frequently with chemical exfoliants and retinoids. Mild peeling indicates exfoliation is working. However, severe peeling suggests your treatment concentration or frequency is too aggressive. Manage peeling by reducing treatment frequency. Use 2 to 3 times weekly instead of daily, reducing concentration. Switch from 2% salicylic acid to 1%, or using shorter treatment durations. Don't pick or peel flaking skin manually, as this damages your skin barrier further. Instead, gently pat moisturizer onto flaking areas and allow them to shed naturally. Redness and irritation are common initially, particularly when starting retinoids or high-concentration treatments. Mild redness that resolves within a few hours is normal. Severe, persistent redness suggests your treatment is too strong. Reduce frequency or concentration. Use the sandwich method to reduce irritation. Apply soothing products like aloe vera or Centella asiatica. If redness persists despite these measures, discontinue the treatment temporarily and consult your dermatologist. UV sensitivity occurs with retinoids, chemical exfoliants, and some other treatments. This doesn't necessarily mean you'll burn easily, but your skin is more susceptible to sun damage. Use SPF 30+ sunscreen daily, reapply every 2 hours if outside, and seek shade during peak sun hours. Wear protective clothing and hats if possible. This is non-negotiable when using photosensitizing treatments. Purging is temporary worsening of acne when starting certain treatments, particularly retinoids and strong exfoliants. Purging occurs as the treatment brings impurities to the skin surface and accelerates cellular turnover. Purging is usually a positive sign that your treatment is working, though it's unpleasant. Purging typically lasts 1 to 2 weeks but can persist up to 4 weeks. If purging lasts beyond 4 weeks or becomes unbearable, discontinue the treatment and consult your dermatologist. Contact dermatitis, allergic reaction, to products appears as itching, rash, or swelling. This is different from typical irritation. If you develop contact dermatitis, discontinue the product immediately. Identify the specific ingredient causing the reaction and avoid it in future products. Common allergens include benzoyl peroxide, sulfur, and certain plant extracts. Hormonal side effects may occur with spironolactone or oral contraceptives. Dizziness, lightheadedness, menstrual irregularities, and breast tenderness are possible. Report any concerning symptoms to your healthcare provider. Regular blood tests ensure your potassium levels and kidney function remain healthy if taking spironolactone. Sensitivity and compromised barrier function result from overuse of strong treatments. Your skin feels tight, uncomfortable, and is reactive to previously tolerated product, etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41-50, Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of Guides 41-50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41, Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42, Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43, Artificial Intelligence and Personalized Acne Treatment, AI-Guided Treatment Selection, Skin Analysis Apps and Accuracy Assessment, Personalization Algorithms, Future of Customized Dermatology. Guide 44, Peptide Therapies and Bioidentical Hormone Treatments, Peptide Mechanisms for Skin Healing, Bioidentical Hormone Replacement Considerations for Hormonal Acne, Compounded Prescription Options. Guide 45, Nanotechnology and Acne Treatment, Nanoparticle Delivery Systems for Enhanced Product Penetration, Liposomal Formulations, Future Nanodelivery Approaches. Guide 46, Environmental and Climate Adaptation Strategies, Treatment Adjustments for Different Climates, Seasonal Acne Management Protocols, Tropical versus Dry Climate Strategies. Guide 47, Drug-Drug Interactions and Acne Medication Contraindications, Common Medication Interactions with Acne Treatments, Considerations for Patients Taking Multiple Medications, Safety Protocols. Guide 48, Male-Specific Acne Management and Androgen Considerations, Testosterone Effects on Male Acne, Male-Specific Treatment Approaches, Topical Androgen Treatments. Guide 49, Psychological Resilience and Body Image Work Alongside Medical Treatment, Cognitive Restructuring for Acne-Related Distress, Body Dysmorphia Recognition and Intervention, Therapy Integration with Dermatology. Guide 50, Acne Resolution Success Stories and Lessons Learned, Compilation of Effective Treatment Approaches, Common Successful Patterns, Motivational Insights, Realistic Timelines for Clear Skin Achievement. Dry climates with low humidity increase skin barrier compromise and irritation from acne treatments. Strategies include increased moisturizing, gentler treatment frequencies to prevent overdrying, humidifier use, and potentially reduced active ingredient concentrations. Seasonal variations require routine adjustments. Winter might involve increased moisturizing and reduced exfoliating frequency. Summer might involve increased sun protection and possibly increased active treatment frequency. Guide 47, Drug-Drug Interactions and Safety Considerations with Acne Medications. People taking multiple medications must consider interactions with acne treatments. Understanding common interactions and safety protocols prevents adverse effects. Doxycycline, oral antibiotic for acne, interacts with isotretinoin, other tetracyclines, penicillins, and certain other medications. Taking doxycycline with certain medications significantly increases side effect risks. Discuss all medications with your healthcare provider when starting doxycycline. Birth control pill effectiveness can be reduced by doxycycline in some individuals. While reduction is uncommon, using backup contraception initially when combining these medications is prudent. Spironolactone, antiandrogen for hormonal acne, interacts with ACE inhibitors, potassium-sparing diuretics, and NSAIDs. Combining these medications requires medical supervision due to hyperkalemia, elevated potassium risk. Retinoids interact with vitamin A and other retinoids. Never combine different retinoid forms. Additionally, retinoids interact with certain other medications requiring coordination. Guide 48, Male-Specific Acne Management and Androgen-Driven Considerations. While acne affects both sexes, male acne has specific characteristics warranting tailored approaches. Understanding male-specific factors improves management. Testosterone drives male acne more powerfully than in females. Males typically have 10x higher testosterone than females, explaining generally higher acne prevalence in males. Reducing testosterone through lifestyle or medications is often unnecessary and undesirable in males. Male acne is often more severe and persistent than female acne, particularly on the back and chest. This distribution reflects androgen receptor sensitivity in these areas. Hormonal interventions appropriate for females, oral contraceptives, spironolactone, are generally inappropriate for males. Males rely primarily on topical treatments and oral antibiotics. Isotretinoin is considered earlier for severe male acne since hormonal treatments aren't options. Lifestyle factors, stress management, sleep, diet, are particularly important for males since pharmaceutical hormonal interventions aren't available. Guide 49, Psychological Resilience and Mental Health Integration with Dermatology. Integrating psychological support with medical dermatology treatment often produces superior outcomes, particularly for acne with significant psychological impact. Cognitive behavioral therapy, CBT, for appearance and irritants to skin, worsening acne. Clean makeup brushes at least weekly with gentle shampoo or brush cleaner. Replace sponges frequently. Use clean hands or clean applicators when possible rather than dirty brushes. Removal of makeup is crucial. Leaving makeup on overnight allows prolonged contact with pores, promotes bacterial growth, and worsens acne. Thoroughly remove all makeup before bed using an appropriate makeup remover or cleansing oil, followed by your regular cleanser. Double cleansing, first with oil-based remover, then water-based cleanser, is particularly effective for completely removing makeup and sebum. Mineral makeup is often better tolerated by acne-prone skin than conventional makeup. Mineral formulations use zinc oxide, titanium dioxide, and iron oxides as pigments without some of the potentially problematic ingredients in conventional cosmetics. Many mineral makeup lines specifically formulate for acne-prone skin. BB creams and CC creams offer lighter coverage than full foundation while providing some color correction. These lighter formulations are often better tolerated by acne-prone skin than traditional foundations. If you need coverage, consider whether a BB cream provides adequate coverage before resorting to heavier foundation. Tinted moisturizers combine light coverage with hydration, often with less pore clogging potential than foundations. For those with mild acne or seeking light coverage, tinted moisturizers can be a good option. Sunscreen itself should be acne-safe. Many sunscreens worsen acne due to occlusive or comedogenic formulations. Specifically choose sunscreens for acne-prone skin, labeled non-comedogenic, oil-free, or for acne-prone skin. Mineral sunscreens are often better tolerated than chemical sunscreens. Testing new products carefully is essential. Introduce one new cosmetic at a time, using it for 1 to 2 weeks to assess whether it triggers new breakouts. If breakouts appear, discontinue the product and wait for acne to resolve before trying a different product. Testing one product at a time allows you to identify which products your skin tolerates. Some people find that minimizing overall makeup use helps control acne more than finding the perfect acne-safe products. If you use makeup only when necessary rather than daily, less product contact with skin means fewer breakout triggers. Consider whether you actually need all the makeup you're using or whether you could achieve similar results with less product. Professional makeup application services for special events often use heavy product application techniques. If you need professional makeup done, inform the makeup artist about your acne and request lighter application and acne-safe products if possible. Alternatively, request that you apply your own makeup at home after a professional provides guidance. The bottom line: find acne-safe products suitable for your skin, apply minimally, remove thoroughly, and use clean tools. This approach allows you to use cosmetics without significantly exacerbating acne. Guide 30: Building your perfect personalized skincare routine, complete advanced framework. After understanding numerous acne treatments and supporting strategies, integrating all this knowledge into a personalized, optimized skincare routine that works specifically for your skin is essential. This comprehensive framework guides you through creating your perfect routine. Step 1: Identify your specific acne profile. Are you primarily comedonal, blackheads, whiteheads? Inflammatory, red pimples, pustules? Hormonal, deep cystic lesions? Severe mixed type? Fungal acne? Acne cosmetica? Your acne type guides which treatments are most appropriate. Comedonal acne particularly benefits from salicylic acid. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Fungal acne requires antifungal treatments. Getting your acne type right prevents wasting time on ineffective treatments. Step 2: Assess your skin type and sensitivities. Is your skin oily, dry, combination, or balanced? Very sensitive or robust? Do you have history of allergic reactions? Do you have rosacea or other reactive conditions? This information determines which products and concentrations your skin tolerates. Sensitive skin requires gentler products, lower active ingredient concentrations, and slower introduction of new treatments. Oily skin tolerates stronger treatments and higher concentrations. Dry skin requires careful moisturizing even while using drying treatments. Step 3: Evaluate contributing factors. What worsens your acne? Stress? Hormonal cycles? Certain foods? Sleep deprivation? Specific products? Environmental factors? Identifying contributing factors allows you to address root causes alongside medical treatment. If stress worsens acne, stress management becomes part of your treatment. If hormonal cycles worsen acne, tracking cycles and timing treatment adjustments helps. Step 4: Set realistic timelines and goals. Most acne improves over 8 to 12 weeks of consistent treatment. Severe acne might take 4 to 6 months or longer. Scars fade over 6 to 12 months with appropriate treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Your goal might be clear skin or manageable acne with occasional breakouts, depending on your acne severity. Step 5. Design your morning routine. Start with a gentle cleanser appropriate for your skin type, used with lukewarm water. Follow with optional essences or hydrating toners if desired. Apply any morning actives, perhaps vitamin C serum for antioxidant protection. Apply your morning moisturizer. Finish with SPF 30+ sunscreen. This entire routine should take 5 to 10 minutes. Keep it simple so it's sustainable. Step 6. Design your evening routine. Start with makeup removal if applicable, oil-based cleanser or micellar water. Follow with your evening cleanser. Apply any evening hydrating toners or essences. Apply your primary acne treatment, perhaps salicylic acid or benzoyl peroxide, starting at low frequency, typically 2 to 3 times weekly. After allowing this to dry, wait 10 to 20 minutes, apply your moisturizer. If using retinoids, apply them now, after at least 2 to 3 weeks of tolerance building. Optional, apply occlusive oil or balm as final step if your skin is dry. Step 7. Plan your treatment introduction sequence. Never introduce multiple new treatments simultaneously. Introduce your first active treatment, perhaps salicylic acid, use it 2 to 3 times weekly for 3 to 4 weeks, then reassess. If tolerating well and seeing some improvement, after 4 weeks consider introducing a second active, perhaps benzoyl peroxide on different days/times. Build your routine gradually over 8 to 12 weeks. This patience is rewarded with better long-term results than aggressive starting. Step 8. Plan adjustments based on response. After 8 to 12 weeks of consistent treatment, reassess. Is acne improving? Are side effects manageable? Do you need to increase treatment intensity? Based on your assessment, you might increase frequency of treatments, increase concentration, add another treatment, or make other adjustments. However, only adjust one variable at a time so you know what caused any changes. Step 9. Incorporate lifestyle factors. Alongside your skincare routine, implement dietary changes, reduce sugar, increase antioxidants, perhaps reduce dairy. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, exercise, or your preferred method. These factors take 4 to 8 weeks to show skin effects but provide significant benefits. Step 10. Plan professional treatments if appropriate. If after 12 weeks of diligent home care your acne hasn't adequately improved, consider professional treatments like chemical peels, laser, or blue light therapy. Monthly professional treatments combined with home care often produce better results than home care alone for moderate to severe acne. Step 11. Plan long-term maintenance. Once your acne clears, identify which treatments were essential for your success and continue them at maintenance levels. Your maintenance routine might be simpler than your treatment routine, perhaps just retinoid at night and sunscreen during the day, but it should continue indefinitely to prevent acne recurrence. Step 12. Build flexibility for adjustments. Your perfect routine isn't static. Seasonal changes, life stress changes, hormonal cycles, and other factors might necessitate routine adjustments. Have a plan for intensifying treatment during high-risk times, increased stress, menstrual cycle high-risk phase. Be willing to adjust your routine based on your skin's response rather than rigidly sticking to something not working. A sample personalized routine for moderate inflammatory acne might look like: morning, gentle cleanser niacinamide serum, optional, lightweight moisturizer SPF 30+ sunscreen. Evening, makeup removal if applicable, gentle cleanser hydrating toner/essence, optional, benzoyl peroxide 2.5%, 3 to 4 times weekly initially, moisturizer optional, retinoid, starting 2 to 3 times weekly after tolerance built. Lifestyle: 7 to 9 hours sleep, 30 minutes exercise 5 times weekly, stress management, diet emphasizing whole foods with reduced sugar. Professional: monthly superficial chemical peels if available. Timeline: 8 to 12 weeks for significant improvement, 6 months for near complete clarity. This framework is meant as guidance, not prescription. Your perfect routine will be unique to your specific acne type, skin characteristics, lifestyle, and preferences. The principle is starting conservatively, progressing gradually, incorporating evidence-based treatments, addressing lifestyle factors, and maintaining long-term consistency. This approach works because it respects your individual skin while following scientific principles of acne treatment. Remember, there's no single, best, acne treatment. There's only the best treatment for your individual skin. Finding that treatment requires dietary changes, hormonal changes. Identifying changes allows you to troubleshoot. Sometimes a simple adjustment, returning to a previous moisturizer, increasing stress management, or addressing dietary changes, restores clarity. For women, track your menstrual cycle and acne patterns indefinitely. If hormonal patterns are evident, you can prepare in advance during high-risk times with more aggressive treatment or preventative actions. Update your routine periodically based on new information. Skincare science evolves. New evidence-based ingredients and treatments emerge. While your core routine remains consistent, you might incorporate new additions. For example, if you weren't using sunscreen consistently but learn about new photostable sunscreen formulations, adding a good sunscreen enhances your results. However, don't constantly change your routine chasing new trends. Consistency matters far more than having the newest products. Have a plan if major breakout recurs. If despite your best efforts you experience significant acne recurrence, don't panic or feel you've failed. Contact your dermatologist to identify what changed and resume professional treatment if necessary. Sometimes life circumstances, severe stress, hormonal changes, medications, require adjusting your treatment approach. Your dermatologist can help. Celebrate achieving clear skin. Reaching this point likely required significant effort and patience. Recognize the achievement and the work that got you there. This perspective helps maintain motivation for long-term maintenance. Guide 20. Integrating all components, your complete personalized acne treatment and maintenance blueprint. After understanding individual components of acne treatment, integrating them into a comprehensive, personalized blueprint is essential. No single treatment works for everyone. Your specific acne type, skin characteristics, and lifestyle factors should guide your approach. Step 1. Accurately identify your acne type. Do you have comedonal acne, blackheads and whiteheads? Inflammatory acne, red pimples? Hormonal acne, deep cystic lesions around your jawline during specific times. Severe acne involving all types. Your acne type guides treatment selection. Comedonal acne responds best to salicylic acid exfoliation. Inflammatory acne responds best to benzoyl peroxide. Hormonal acne often requires systemic hormonal treatment. Severe mixed acne usually requires combination treatments and potentially professional intervention. Step 2. Assess acne severity. Mild acne, fewer than 20 comedones, fewer than 15 inflammatory lesions, no nodulocystic lesions, often responds adequately to topical treatments alone. Moderate acne, 20 to 100 comedones, 15 to 50 inflammatory lesions, no nodulocystic lesions, typically requires combination topical treatments, possibly with professional treatments. Severe acne, extensive lesions, numerous nodulocystic lesions, usually requires systemic treatment including oral antibiotics, hormonal treatments, or potentially isotretinoin. Step 3. Consider your lifestyle factors. Are you comfortable with multiple daily skincare steps? Can you prioritize sleep and stress management? Will you maintain consistency? These practical factors determine whether complex multi-step routines are realistic for you. Some people thrive with detailed routines, others do better with simplified approaches. Step 4. Design your core routine. Everyone benefits from a consistent cleanse, treat, moisturize, protect routine. Select specific products for each step based on your acne type. For comedonal acne, use a gentle cleanser, apply salicylic acid treatment, use a non-comedogenic moisturizer, apply sunscreen. For inflammatory acne, use a gentle cleanser, apply benzoyl peroxide treatment, use a moisturizer, apply sunscreen. For mixed or severe acne, consider consulting a dermatologist for prescription treatments. Step 5. Start conservatively with treatments. Begin with a single active ingredient at low concentration, using it 2 to 3 times weekly. After 3 to 4 weeks of good tolerance, assess results. If you're seeing improvement, continue. After 8 weeks, you can increase frequency or concentration if desired. If you're not seeing improvement after 8 to 12 weeks, consider adding a second treatment, for example, adding retinoid to salicylic acid, or consulting a dermatologist. Step 6. Build treatment combinations gradually. Never start 2 new treatments simultaneously. After establishing tolerance to your first treatment, at least 4 weeks, you can introduce a second treatment on different days or in different parts of your routine. For example, use salicylic acid cleanser in the morning, retinoid at night. Start the new treatment at low frequency and concentration, building up gradually. Step 7. Incorporate lifestyle changes. Implement dietary improvements, reduce sugar, increase antioxidants, consider eliminating dairy if it worsens your acne. Prioritize sleep, 7 to 9 hours nightly. Implement stress management, meditation, yoga, exercise, or other stress reduction techniques. These changes typically take 4 to 8 weeks to show skin effects but provide significant benefits. Step 8. Implement professional treatments if appropriate. If topical treatments aren't adequately controlling your acne after 8 to 12 weeks of consistent use, or if you have moderate to severe acne, professional treatments accelerate improvement. Monthly superficial chemical peels combined with your home routine provide excellent results. Professional facials or blue light therapy offer additional options. Step 9. Adjust for your specific factors. If you're a woman with hormonal acne, discuss hormonal treatments, oral contraceptives, spironolactone, with your gynecologist or dermatologist. If you're very acne-prone, you might need slightly more aggressive treatment than someone with occasional pimples. If your skin is sensitive, you'll need to progress more gradually with treatments. Step 10. Track your progress and adjust. Keep a skincare journal noting products used, frequency, side effects, acne status, stress levels, diet, and sleep. After 8 to 12 weeks, assess results. Have you seen improvement? Are side effects manageable? Are you ready to increase treatment intensity? Are you experiencing purging or adaptation? Adjust accordingly. Step 11. Set realistic timelines. Clear skin typically requires 8 to 12 weeks with topical treatments alone, potentially faster with professional treatments. However, residual hyperpigmentation and scarring may require additional time and treatment. Setting realistic expectations prevents discouragement from expecting overnight results. Step 12. Prepare for long-term maintenance. Once clear, continue your core routine indefinitely at maintenance levels. Don't expect to stop all treatments and maintain clear skin. Your skin's acne tendency hasn't fundamentally changed. Maintenance requires ongoing treatment, though frequency may decrease significantly. A sample complete routine for moderate mixed acne. Morning, gentle cleanser vitamin C serum, antioxidant protection, optional, non-comedogenic moisturizer SPF 30+ sunscreen. Evening, gentle cleanser salicylic acid toner or treatment, 3 to 4 times weekly initially, non-comedogenic moisturizer benzoyl peroxide spot treatment on active lesions or retinoid treatment, start 2 to 3 times weekly. Supplements, omega-3 supplementation, possibly zinc supplementation if deficient. Lifestyle, 7 to 9 hours sleep nightly, 30-minute exercise 5 times weekly, stress management through meditation or yoga, diet emphasizing whole foods and reducing sugar/dairy. Professional, monthly superficial chemical peels if available and affordable. This comprehensive approach addresses acne through multiple angles simultaneously. After 8 to 12 weeks of consistent implementation, you should see significant improvement. After 6 months, most people achieve clear or nearly clear skin. After a year, you've developed habits that maintain clear skin long-term. Remember, acne treatment is individual. What works perfectly for one person may not work for another. Patience, consistency, and willingness to adjust are more important than finding the perfect product. Most acne responds to consistent, appropriate treatment. It's a matter of identifying what works for your specific skin and persisting with it. You now have a complete understanding of acne pathophysiology, treatment options, professional treatments, lifestyle factors, and integration strategies. Armed with this knowledge, you can approach your acne treatment confidently, make informed decisions, and achieve and maintain clear skin. Your journey to clear skin is absolutely possible with proper treatment, professional guidance when needed, and consistent effort over time. Commit to the process, trust in evidence-based treatments, and clear skin will follow. 20 Advanced Skin Care and Acne Treatment Guides, Part 2. Each guide, 10 to 15 minutes reading time. Guide 21, Isotretinoin, Accutane, the definitive acne treatment for severe and resistant cases. Isotretinoin, commonly known by its former brand name Accutane, represents the most powerful acne treatment available. It's the only medication that can potentially cure acne permanently. However, its serious potential side effects mean it's reserved for severe, treatment-resistant acne and requires careful medical supervision. Understanding isotretinoin, its mechanism, effectiveness, requirements, and side effects, is essential for anyone considering this treatment. Isotretinoin is a vitamin A derivative, but far more potent than over-the-counter retinol or even prescription tretinoin. It works through multiple powerful mechanisms. First, it dramatically reduces sebaceous gland size and sebum production by up to 90%, essentially eliminating one of the 4 primary factors in acne development. Second, it normalizes follicular keratinization, preventing dead skin cell accumulation that leads to comedones. Third, it has powerful anti-inflammatory effects, reducing the inflammation driving acne. Fourth, it has some antibacterial properties, reducing Cutibacterium acnes populations. The combination of these mechanisms makes isotretinoin extraordinarily effective. Approximately 70 to 90% of patients achieve complete, long-term acne remission after 1 course of isotretinoin. Many patients are cured permanently, their acne never returns. The individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for transfeminine individuals, typically improves acne over time as androgens are suppressed. Many transfeminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne-beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in transfeminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55. Nutritional deficiencies and acne, zinc, vitamin D, selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56. occupational acne syndromes, tar acne, oil acne, and chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, automotive work, and similar occupations. These oils are comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Guide 63, Acne in Patients with Liver Disease and Metabolic Disorders. Liver disease and metabolic disorders can affect acne through various mechanisms. Managing acne in these populations requires special consideration. Liver disease affects hormone metabolism, potentially worsening hormonal acne. Patients with cirrhosis or chronic hepatitis often have worsened acne due to impaired estrogen metabolism and altered hormone regulation. Metabolic syndrome, combination of obesity, insulin resistance, hypertension, and dyslipidemia, correlates with worse acne. Or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54, Drug-Induced Acne and Medication Side Effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrol, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55, Nutritional Deficiencies and Acne, Zinc, Vitamin D, Selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking. Treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13, Face Masks and Professional Facials for Acne Management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily stimulating sebaceous gland activity and follicular changes. This is why adolescent acne is so common and often severe. Acne's psychological impact during adolescence is particularly significant due to developmental sensitivity about appearance and social dynamics. Acne during formative teenage years can cause lasting psychological effects. Taking adolescent acne seriously and treating it appropriately is justified. Guide 98, Acne and Body Dysmorphic Disorder, Distinguishing Clinical Concern from Pathology. Body dysmorphic disorder, BDD, is excessive preoccupation with perceived appearance flaws, sometimes involving acne. Distinguishing between appropriate concern about actual acne and BDD helps ensure appropriate treatment. Normal acne concern involves recognizing acne exists, wanting to treat it, and feeling moderately bothered. This is appropriate and doesn't indicate pathology. BDD involves disproportionate distress about minor or imagined flaws, repetitive behaviors, mirror checking, skin picking, comparing, significant functional impairment, and disproportionate appearance focus. Someone with BDD focused on acne might have minimal actual acne but experience severe distress and dysfunction from perceived severe acne. BDD requires mental health treatment, therapy, sometimes medications, rather than dermatological treatment alone. Treating actual acne doesn't resolve BDD if actual acne isn't the primary problem. Recognizing BDD allows appropriate referral to mental health providers. Dermatologists familiar with BDD can identify it and recommend mental health evaluation. Having actual acne doesn't preclude also having BDD. Someone might have real acne and also have disproportionate BDD-related distress. Guide 99, Acne Treatment Optimization through N of 1 Experimentation. N of 1 trials involve testing treatments in yourself systematically to determine what works best for your specific skin. This personalized approach optimizes your individual treatment. N of 1 testing involves trying one treatment change at a time, tracking results objectively, comparing periods with and without treatment. For example, testing whether dairy worsens your acne. Eliminate dairy for 4 weeks while maintaining everything else constant, track acne objectively, then reintroduce dairy and track acne again. If acne improved without dairy and worsens with dairy reintroduction, dairy is likely a personal trigger. Similarly, testing whether specific products, ingredients, stressors, or other factors affect your acne using single-variable experimentation personalizes your treatment. Tracking variables, diet, sleep, stress, products used, acne status, in a detailed journal enables N of 1 analysis revealing personal patterns. This personalized approach identifies your specific acne triggers and treatment responses better than general recommendations, since everyone's acne differs. Guide 100, Acne Future, Emerging Research, Potential Breakthroughs, and What's Next. Acne research continues advancing, with numerous promising approaches under investigation. Understanding emerging research provides hope for improved future treatments. Microbiome-targeted treatments using probiotics or postbiotics specifically addressing acne-associated microbiota changes are in development. These might provide more targeted bacterial management than broad-spectrum antibiotics. Precision medicine approaches using genetic testing to predict acne predisposition and treatment response are emerging. Personalized treatment based on genetic profiles might become reality. Immunotherapy approaches boosting immune response to acne bacteria or reducing inflammation are under investigation. Nanotechnology delivery systems enabling more targeted, deeper drug delivery are advancing. Future treatments might be more effective and have fewer side effects through optimized delivery. Gene therapy approaches, still experimental and far from clinical use, might eventually target genetic predisposition to acne. Plant-based and botanical treatments with stronger evidence are being developed. Future treatments might offer natural alternatives to synthetic drugs. Combination approaches